Welcome to Utano podcast. Let's talk about health in Africa, the podcast where we tackle the toughest questions in global health from an African perspective. My name is Lenias, Hwenda, and today we are asking, what happens when foreign aid pulls back? Is it a crisis or is it a catalyst for change? Joining us today is Professor Ntobeko Ntusi, a leading voice in South African health research. He is the CEO of the South African Medical Research Council, and he's going to unpack the future of health funding, innovation, and African self-reliance for us. So let's dive in. Professor Ntusi, welcome to Utano Podcast.
Thank you very much, Lenias. It's wonderful to be here.
Now, Professor Ntusi, the US has historically been a significant funder of health programs of health research in South Africa and in other countries as well around the continent of Africa. How has the recent withdrawal or reduction in US aid funding, particularly from programs like PEPFAR, affected research in South Africa and in the region?
The ramifications have been substantial, with impact on health services, particularly in sub-Saharan Africa, where most countries had relied on USAID and PEPFAR funding for provision of antiretroviral therapies for HIV, but also for active case finding and treatment of tuberculosis and many other neglected diseases. And with very little time for mitigation, many of these governments have had to scramble, and the real victims of this occurrence have been the citizens of these countries. In terms of the research itself, there have been really significant disruptions to key research operations. Many staff who were employed in these research programs and postgraduate students were being trained, being adversely affected, and many either losing their jobs or losing opportunities for training. We've also seen that a lot of the research infrastructure, either for clinical trials or research infrastructure for enabling platforms and facilities which were procured through US federal funding, being under threat as the sources of funding for their maintenance have been withdrawn. But I think at a much bigger scale, the impact is felt by big pharma. If you look at companies like Abbott, Merck or MSD, Pfizer, Gilead, and many others who for decades have relied on the South African research ecosystem in particular, but also the ability to conduct research for new anti-infective therapies or vaccines in Africa, being not able to do that as well. And then finally, I think one needs to recognize that this is also a very anti-American thing, because the impact is felt equally within the US, with many of the institutions that have been the bedrock of American scientific prowess, like the NIH, the CDC, USAID, FDA, the Environmental Protection Agency, and many others facing significant change and strain in this period, which I think will affect the health of the American people as well as the health of all citizens around the world adversely as a consequence of these changes.
Yes, and indeed the point that you're making, Prof. Ntusi, is that the research that is done in South Africa is not only serving South Africans and Africans, but people in the US as well. So the impact goes way beyond South Africa and affects people in the United States and around the world.
Yeah, it's a really important point you make. So if you look at the impact of US federal investment in South Africa over the last 3 to 4 decades, it's resulted in the development of this cadre of exceptionally high-performing scientists who have led a seminal scholarship that has been good, as you say, not just for South Africa,
Yes.
but for the whole world. And if you look at American guidelines for pediatric and adult HIV, for instance, about 30% of the references come from South Africa. In my own work has contributed to guidelines for management of cardiovascular disease in the US, and the same is true for many of our leading scientists. And I think in the current era of a very interconnected global health ecosystem, thinking that one can act locally and ignore the distant ramifications is very flawed.
Now, some people argue that these aid cards are a wake-up call for Africa because, you know, we were too dependent on external funding, and that perhaps this is an opportunity. Do you see this as a crisis or an opportunity for South African health research community?
I think it's both. I think it would be fallacious to deny the catastrophic impacts of this crisis. I mean, if you look at USAID alone, it employed over 250,000 doctors and over 1 million nurses and other healthcare workers in the 54 countries in Africa, many of whom lost their jobs abruptly. In South Africa, there were about 20,000 healthcare workers who were affected. And so the impact has been absolutely dreadful.
Yeah.
But I think there's an opportunity here for African governments to look at how they prioritize the funding of the health of their own populations and to see how they reduce the reliance on external sources. And I think it's important to recognize that most African governments are not poor. If you look at how much goes annually into the budgets of their militaries, or how much is misappropriated in corruption, it's substantial. And I think if there's sufficient political will, these resources can be channeled into more helpful interventions for society. And I'm delighted that the South African government has really seized this opportunity and come to the party in a big way and have responded quite favorably to our calls for greater investment, both in health services, but also health research.
Yeah, so that's really very encouraging to hear that governments on the continent, you know, starting with South Africa, are really stepping into the fold and taking matters into their hands to plug that gap that has been left by the funding that has been withdrawn now. So with that, you know, the fact that the South African government is stepping in, what are the strategic shifts that the South African Medical Research Council is making in response to the changing global funding landscape with the South African government coming in? How does that help you to move forward?
Yeah, so we've done, I think, 4 things. The first is to relook our strategic priorities and to ensure that these are aligned with burden of disease.
Yes.
aligned with the priorities articulated by our National Health Research Committee, but also through stakeholder interviews, ensured that we are able to identify the most pressing health needs in the country as articulated by partners in academia, civil society, industry, and government. So that's been the first thing we've done. And the second has been to look to see how we diversify our sources of income and income to support these articulated strategic priorities.
Yes.
And we have reached out to the government and to our national treasury and received commitments for greater support for health research. And in the recent past few weeks, we have disbursed about 400 million South African rands to researchers who were affected by these funding cuts. And in the coming weeks are looking to see how we support research in other ways. We have also reached out to local philanthropy and local corporates who traditionally have not really supported health. And the response has been overwhelmingly positive, and we are looking to see how we build those local linkages, and for us to really keep driving the point that those with resources need to support local needs rather than us having to look beyond our borders. Then finally, we've recently received permission from the South African government to establish an SAMRC foundation, which in design will be very similar to the MRC Foundation in the UK or the Foundation for the NIH in the US, aiming to build a large endowment to support biomedical, health, and behavioral sciences research in South Africa and the African region with less reliance on governments.
That is an awesome development, Prof. I think it sounds like the sort of thing that is really going to secure the health, research funding on the continent. Tell me, Prof, why do you think it has taken us this long to get to that point where we establish these kinds of structures to secure health research funding on the continent?
I think in South Africa, in many ways, we've been a victim of our own success. As you know, South Africa as a country has been the largest recipient of NIH funding outside of the US. And our scientists have been able to compete with the best scientists in the US and globally for support for research, particularly on HIV, AIDS, as well as TB, but also other areas. And because we've been able to do this very well, we have not had to think about mechanisms to support. I mean, another example is if you look at funding from the European Commission for Health Research.
Yes.
Two institutions in this country, University of Cape Town and Stellenbosch University, collectively hold more EU grants for health research than any other country outside of the European Union. And so we have this excellence in health research, which has enabled our scientists to be able to leverage our funding, competing against the best scientists in the world. And we have not had to look at alternative ways of funding until recently.
Yes. So it's basically South African scientists have been so competitive globally that they've been able to win funding without necessary, and that hasn't been a drawback or an impediment in the past, but now it is necessary, and we're seeing the government stepping in. So Prof, is this then an opportunity or a moment of redefining partnerships, for health research, bringing in the private sector, philanthropic funds and others across the spectrum on the African continent to secure funding in the future?
Yeah, I think it goes without saying that successful research enterprises obtain funding from a variety of sources, and for health innovation to be successful, it's always predicated on a collaborative endeavor between governments, academia, industry, civil society, and the sources of funding necessarily also need to have multiple sources. And I think at a time of need, the real value of those collaborations or partnerships is even more apparent.
Yes. And what does this mean for how we define research priorities in South Africa and beyond?
So I think research priorities need to be aligned with local priorities. And this needs to be driven by a understanding of the burden of disease in each country. In South Africa, for many years, we've spoken about the quadruple burden of disease, which is the intersection of endemic infections like HIV and TB, non-communicable diseases, the impact of maternal, neonatal, and childhood mortality, as well as interpersonal violence and trauma. And these collectively account for the greatest share of both morbidity and mortality in our setting. And so for us, it's been appropriate that our priorities largely focus on these. But also we have realized the importance of investing in emerging threats like climate change and health, being better prepared for future pandemics, countering antimicrobial resistance, and of course, having clearly articulated strategies for digital health and AI. And so alongside that quadruple burden of disease, we are also making the investment case for these other important areas. And I think each country will look to see what their burden of disease is and to ensure that their health research programs fundamentally address these. And it goes without saying that there's a need to move away from the traditional donor-based funding where donors decide who leads organizations, who gets to receive funding, what interventions or strategies are prioritized, and who the beneficiaries of research should be. And in the era of decolonization of global health, this is not only grossly inappropriate, but frankly offensive. And so it's something that we need to move away from.
Absolutely. No, that is clear. And I guess, this really is clearly an opportunity which is giving leaders like yourselves in the African continent, giving them more control and more scope to define what it is that is the most important research that serves African communities. Now, can you speak to any promising South-South collaborations or regional partnerships that South Africa is also thinking about leveraging in order to fill the gap left behind and to keep the ambitions that we have of improving healthcare in Africa?
So I must say, I don't like the terms Global South and Global North because they position the Global South in a asymmetrical relationship, which is often pejorative
Yes.
to the North. And I prefer to use the term global majority,
Yes.
which is where 85% of people from low and middle income countries reside, at least 85% of the
Yes.
world population. And for me, these collaborations between players in the global majority are absolutely key.
Yes.
On the one hand, they enable the development of a community of practice amongst those with similar priorities. And at the same time, they enable the sharing of learnings and experience in people in similar contexts.
Yes.
And we have a number of really successful partnerships, and maybe I can share one with you that we are championing. The World Health Organization, together with the Medicines Patent Pool,
Yes.
in response to the vaccine apartheid demonstrated during the COVID-19 epidemic, and subsequently at the beginning of the Mpox and Ebola outbreaks, decided to establish an mRNA technology transfer hub, with South Africa as the implementing agency. The South African Medical Research Council is the one that is leading this work of implementing this hub in collaboration with Afrigen and BioVac. And we have a hub and spoke model with the hub in South Africa that we are leading, with spokes in 14 different low and middle income countries in Africa and Asia. And through this, we've been able to negotiate the tech transfer for a number of vaccines, and showing that we can manufacture high quality products from Afrigen, and then transferring that to BioVac, where we can manufacture at scale, and then transferring those learnings to the different spokes within the network. And it's been a very successful and I think will continue to be a very impactful partnership, enabling sustainable mRNA capacity in different countries in the global majority.
Yes, that is an excellent example. In fact, we've had Professor Terre Blanche here on Utano podcast, talking about this initiative. So we are very familiar with it and how well it has done in terms of, leveraging that knowledge transfer, knowledge exchange amongst low and middle income countries. And I suppose in many ways, it is one way to really forge a future-ready, self-reliant health system, which is coupling, of course, the research, the development of the pharmaceutical vaccine manufacturing ecosystem, and leveraging that to improve healthcare within African communities. Talk to me about what a future-ready, self-reliant health system looks like in South Africa. What would be the key components that you think are the most critical ones in terms of research, training, infrastructure, and where are you in South Africa with this?
Really important question. And I think there are several key elements. The first is to ensure that you've got a clearly articulated set of priorities and appropriate interventions.
Mm.
And then secondly, to ensure that your research, generation of new knowledge, application of existing knowledge in new ways, all the way from discovery science, translational and basic sciences to clinical trials, population health, implementation research, the entire spectrum is aligned with these priorities and enables you to be able to answer fundamental questions about the health of the society. And then thirdly, to ensure that there is an alignment between the research you conduct or the questions you ask about your health system to how you train and the conditions you prioritize in your training, as well as how you organize your health services, so that you are able to really address these key challenges. And I think despite its many challenges, the South African health system does this in a reasonably good way. And a lot of our research focuses on that quadruple burden of disease. A lot of the training we do is similarly focused on those, and the design of our health systems is in such a way that we are also able to optimally address those while at the same time being able to be prepared for other emerging threats.
Yes, and of course, all of these, I mean, this is quite important. And we see the South African government, as you mentioned, really stepping into the fold and picking up the ball and running with it. And political will is a critical component, an important aspect of making all of this come together in an impactful way. Are you seeing political will, commitment beyond South Africa, in other regions? I presume you would collaborate with other countries as well in the region.
I think so. So my sense is that there is increasing goodwill amongst decision makers, increasing commitment amongst politicians. But the challenge is, in many countries, this is the case here, there are so many competing demands for limited resources, with health being one of those, but education, infrastructure, poverty alleviation, etc., and being able to position health as a prime beneficiary is not always easy to do. Whenever I engage with decision makers and politicians, which I'm very fortunate to be able to do regularly in my position, I constantly try to state the value proposition of investment in science and health research in particular as being fundamental to human capacity development, as well as the generation of a knowledge economy. And I think once politicians understand that inextricable link, it makes it easier for them to see that good health is not only good for survival of their populations, but it's fundamental for thriving economies and thriving societies.
Yes. I mean, South Africa has a long history learning on this journey. You've it's one of the, it's the most successful country on the continent in terms of health research. And I would imagine that you've learned, by trial and error, making mistakes and so forth, to get to this point where so the South African leadership, the president and others are really stepping in and saying this is important and we must fund it ourselves. What are the common pitfalls or some potential pitfalls that you would perhaps you might advise other countries to that you think would be important to avoid as they try to move with this agenda of building health research and health systems?
So I think in responding to the funding crisis, we are finding ourselves in, as different countries seek solutions, I think it's absolutely critical that they do not find solutions that place them in another position of dependency, as many of them have been, and for the countries to really find ways of expressing their sovereignty in health and their sovereignty in science. And what that means necessarily is that African governments need to invest in the health of their population by supporting both scholarship or research, as well as supporting improved health services. And I think it becomes easier to leverage mesh funding from outside when there is proof of states that have skin in the game, yes, rather than going out there with begging bowls and not really being invested in this. So I think for me, that is the key message, not to replicate models of dependency that will couch African countries in a similar position. And when the new funders choose to pull out, we again find ourselves in the same position that we did this year.
Yes, yes. Let's finish by looking ahead, Prof. Let's look at, let's say, a young African researcher or healthcare professional. How can they be a part of this new vision that you are defining at the South African Medical Research Council with everything that you're doing to fill the gap, to redefine the way forward? What innovations or breakthroughs are you currently investing in that also reflects that move towards self-reliance? And how would you advise young professionals to be a part of it?
Yeah, so my advice to young scientists would be to acquire the skill sets that Africa needs, whether you do so through training in countries on the continent or going outside the continent if you need to, and then ensuring that you retain and contribute from within to address the fundamental challenges of our continent. And really, it's easy to stand on the sidelines and criticize, but really to look to how we can all be part of the solution. I must say, in my work, I get to travel extensively through the continent, and I meet daily lots of incredibly talented young African scientists who leave me filled with such profound optimism for the future of our continent. And my big dream is to see many of those leading solutions that will help advance the needs of our continent.
Wonderful. Professor Ntusi, thank you for sharing your insights and your vision. It's very clear that whilst we still have challenges in South Africa, on the continent, the shift in how we look at how we fund health care research could also be a turning point. And this is an opportunity for Africa to lead with its own priorities, its own expertise, and its own solutions. And to our listeners, the future of health in Africa doesn't lie in dependency, but in self-determination, in collaboration, and in innovation. So let's continue the conversation. And more importantly, let's be part of the change. So until next time, stay informed and stay inspired. Professor Ntusi, thank you so much for joining us today on Utano Podcast.
Thank you so much, Lenias. It's been wonderful engaging with you.